Good evening, everybody, and welcome to the webinar Vet. My name is Bruce Stevenson, and I have the honor and privilege of chairing tonight's webinar. We are doing something very unique tonight from a couple of aspects. First of all, our sponsor tonight is Becton Dickinson, and they are absolutely unique in that they have come to us as veterinarians and asked us, what is it we want? What do we want to hear? And the response that we gave them is we want to know about chemo, we want to know about catheters, and we want to know about environmentally friendly plastic syringes. So they've gone away and they've found some great presenters for us. They've presenting for us tonight. But the next unique thing is the method in which we are going to be presenting. So bear with us if we have a couple of little technical hitches along the way, because it is something that we haven't done before. But I'm sure it's all going to be absolutely fantastic. And just before I move on, once again, Becton Dickinson, our sponsors, thank you so much for this unique approach and for giving us the opportunity to test and trial this method, which I think I agree with you is the right way of doing things. A little bit of housekeeping for those attending. If you do want to ask a question, simply move your mouse over the screen. A little Q&A bar or a little control bar will pop up. There's a Q&A box. Just click on that, type your question into that. It'll come through to us. We will be holding those questions over to the end, and then we will have a discussion with our presenters at the end. Speaking of our presenters, we do have recordings of our presenters, but we have them on live afterwards as well. I did promise you this was going to be unique. Becton Dickinson doesn't do anything ordinary. Everything's done special. So recording with our live presenters present for the questions afterwards, but we may not get through all the questions at the end. So if we don't panic. Those questions will all be passed on to BD so that they can get in touch and answer all your questions. Speaking of getting in touch, I will remind you at the end as well, when we finish the webinar, you will have a survey pop up on your screen. Please, please, please take the time and the effort to fill that in and give feedback to our great sponsors tonight so that they have a way of measuring how successful this approach and method has been. So without further ado, our main speaker tonight is Stuart Ford-Fennah, and he has a very varied career which encompasses clinical, academic, publishing, and editorial work. Stuart graduated from the University of Bristol with an honours degree in veterinary nursing and practice administration, and he is currently studying towards achieving his master's in business administration. For the last 16 years, Stuart has been administering chemotherapeutic agents to veterinary patients and educating in safe practice for this procedure. Stuart, welcome to the webinar Vet, and over to you.
Thank you very much. Okay, so we're going to talk about using cytotoxics safely, namely giving them and a few little extras. What we'll do, we'll go through a nice kind of talk this evening. We'll talk a little bit about the legislation in the UK and a little bit of the EU as well. And then we'll talk about the risks, and then we'll talk about some preparation, move on to administration, and then dealing with all the other things that happen after administrating these drugs. So first of all, we need to think about the kind of legal framework that we all have to work within. And you know, for the UK, we have the Health and Safety Executive, and most of our laws are based on EU regulations, certainly until recently. We have the Health and Safety at Work Act, Managing Health and Safety Work Regulations, which are all components of our law, which businesses and individuals can be fined upon if they're not meeting the criteria. And more importantly, the one which is very much targeted towards cytotoxics is the control of substances hazardous to health. Now, it's a big document, and thankfully, the HSE for us has produced a approved code of practice,